As Australia's housing and rental crisis continues to worsen, more and more people are pushed out of their homes and onto the streets. It's become such a widespread problem in 2023 that more than 220,000 people across the country accessed homelessness services. Now, no level of government seems to know what to do. Thankfully, though, there are smart and caring Australians who have some brilliant ideas on how to take real action, like Streetside Medics and Young Australian of the Year, Dr. Daniel Nour. Doctor, thank you so much for coming on. I've known you for many years now, and you are one of the most impressive people we have in this country, so we're grateful for you. Before we start, you wish that this incredible thing you've built didn't have to exist, don't you? You wish there wasn't a homelessness crisis in this country.
I wish we didn't even have to talk about people experiencing homelessness. I mean, the fact that we're in the 21st century, we're such an established nation and world, yet there are people living on the streets, living in their cars. It's a shame. It's a huge shame.
You're saying this is now at crisis level and we're somewhat emulating what's occurring in the United States.
Yeah, absolutely. I think if you look at our society and the trends of how we're growing, and you look at the States, a city like San Francisco, it would not surprise me if in 5-10 years we are exactly what the States is facing right now. And I think in many ways we already are there. And I think that we are in a crisis state. And we are in a state where the rise of homelessness, people experiencing homelessness, the people feeling the financial burden, the wealth gaps are growing as corporate wealth surges. People are facing even more challenges than we could have ever imagined. And I think we are in a crisis state and we really need to revisit what we're doing.
Now, Streetside Medics essentially takes vans out that are equipped with medical equipment and visits homeless people so they can check out things that might be large, minor, small, anything in between, medications, etc. It's an incredible idea, an incredible service. It does so much good and it saves the taxpayer a phenomenal amount of money because normally those people would be going to emergency.
Yeah, correct. I mean, the original way that I enticed government was the cost benefits.
Yes.
It's a GP-led model dedicated to those experiencing homelessness. There are barriers that limit access to healthcare. Trust, level of transportation, documentation required, previous negative experiences, stigma, but also health priority. More concerned about where am I sleeping and what am I eating, rather than why do I have a bloody cough or why are my legs swollen? And so our service changes the paradigm of how we deliver healthcare. We have a van set up as a clinic and we take it to them. We take it to food services, and we take it to shelters, and we alleviate as many of those barriers as possible. And I haven't said this too much publicly, Erin, but you know me quite well. When I first started Streetside Medics, I was 24 years of age. I had barely any money to my name, but I was so passionate. And I was passionate because I saw people experiencing homelessness. I'd go to a food service as a volunteer and I would see the healthcare problems that they're facing and ask them. And to my surprise, when I went to a number of these large organisations and I pitched my idea, most of them tried to shut it down. They either told me it wouldn't work or that it would fragment care and that it wasn't needed and I should take it elsewhere. And that's why I'm so passionate about this idea of trying to have a homelessness commissioner. There are so many amazing services that are doing amazing work, but in silos. And if we don't have some level of coordination...
Bringing it all together,
overseeing it, collaborating. Rome wasn't built over a day, and homelessness is an issue that is huge, it's complex. I don't have the solution. I wish I could sit here and tell you I know exactly what to do, and I can't blame the politicians because it's a complex issue that we can't solve with any one intervention. But I truly believe that two things. We need a homelessness commissioner, but more than that, and I hate to say this, and this will offend some people, but a lot of people reach out now and say, we want to start a food service, or we want to start this or that for people experiencing homelessness.
Which on the surface level is a lovely thing to do.
A lovely thing. But you know what I truly believe it's doing? It's making us feel better. It's making us feel like we're doing something. We're doing something for people that are less fortunate than us. It's giving corporates a tick that they're
patting themselves
on the back. And for me, what I'm more interested in is why do people experience homelessness to start with? When they do experience homelessness, why do they stay in that state of homelessness? And how can we address the root cause of that problem and change that? And healthcare is only one of them. Education is one of them. Opportunity is another one of them. It's homelessness, not houselessness. There are so many people that are lonely in our society that have no one to turn to, that if you provided them a house, and many of our patients will say we can get you a house, if you provided them a house, they don't want it. And so I truly believe that we need to stop this woke agenda of patting ourselves on the back and really start to look deeply at why do we have a homelessness crisis to begin with and how do we make change?
And that will only happen with someone coordinating everything and bringing all the different ideas.
Correct.
Before I let you go, you're operating in Sydney. I've been out with you guys at night. You do such an incredible job. You're launching in Melbourne, I think, in August. Tell me a little bit about that.
So it's the biggest move we've made. We started in the middle of COVID in February 2020, and we grew the organisation, Young Australian of the Year in 22, put the spotlight on the organisation, and it's taken us some time to build it to a space where we can now grow. And so we've grown the organisation to launch in Melbourne in August. And what that really means for us is that we can increase our capacity to reach more people. There are over 170,000 people experiencing homelessness in Australia, more than double that accessing the services. And our goal is to not leave a single person with limited access to healthcare.
And hopefully down the track to become completely redundant.
Exactly, absolutely right.
Dr. Daniel Nour, you're brilliant. Streetside Medics, guys, make sure you look them up. Thank you so much for joining me here on Erin. Really appreciate it.